Multiple laboratories have demonstrated that people who are asked to write about traumatic experiences subsequently exhibit better physical health than people who are asked to write about superficial topics. In the past 15 years, dozens of replications have demonstrated that emotional writing can influence frequency of physician visits, immune function, stress hormones, blood pressure, and a host of social, academic, and cognitive variables. In other words, through research, nalaman natin na expressing your emotions or letting out your emotions through writing or expressive writing does improve your mental and physical health. But we still don't know what are the psychological and biological variables, structures, and processes that were involved, and how do they connect the act of expressive writing to improve an individual's health. Although there have been several ideas that were proposed. For example, people who write about traumatic experiences might habituate to them, and therefore, the more they think about them, the less negatively they react both psychologically and physiologically, leading to improvements in mental and physical health. This example illustrates that, like all scientists, researchers in psychology distinguish between two sorts of knowledge: their systematic observations, or phenomena, and their explanations or interpretations of those observations, or what we call theories. Okay, now let's talk about the phenomenon. It is a general result that has been observed reliably in systematic empirical research. It is an established answer to a research question. For example, here are some famous psychological phenomena. Also take note, class, that phenomena are often given names by their discoverers or other researchers. For example, we have bystander effect. It is a phenomena in which the more people who are present at an emergency situation, the less likely it is that any of one of them will help. Kumbaga naasa yung ibang tao na may tutulong naman na iba, that's why they don't initiate on lending a hand to those who are in trouble. Next, we have placebo effect. Placebos can be fake psychological or medical treatments that somehow led to improvements in people's symptoms and functioning. We also have what we call halo effect. The halo effect is when one trait of a person or thing is used to make an overall judgment. It supports rapid decisions even if these are biases. By the way, take note, class, that when we say empirical result, it is referred to as a phenomenon after being observed only once, whereas phenomena is more likely to be used for results that have been replicated, meaning to say it is not only observed once but multiple times. Now, how about theory? A theory is a coherent explanation or interpretation of one or more phenomena. It can be untested, but it can also be extensively tested, well supported, and accepted as an accurate description of the world by the scientific community. Whereas a hypothesis, it can be an explanation that relies on just a few key concepts. Although this term is more commonly refers to a prediction about a new phenomenon based on a theory. So what are the theories for? First of all, theories allows researchers and others to make predictions about what will happen in new situations. In clinical psychology, treatment decisions are often guided by theories. For example, the scientific theory of dissociative identity disorder is that people develop multiple personalities because they are familiar with this idea from popular portrayals, and they may also be unintentionally encouraged to do so by their clinicians by asking them to meet an alter or create a new personality for themselves. This theory implies that rather than encouraging patients to act out multiple personalities, treatment should involve discouraging them from doing this. Next, theories help us to generate new research by raising new questions. For example, the theory that people engage in self-cutting because it reduces negative emotions such as sadness, anxiety, and anger. This theory suggests several questions, like is there a statistical relationship between cutting and the amount of negative emotions experienced by the person? And what makes cutting satisfying for the person? Is it the pain experience, the site of the injury, or something else? Thus, these questions may lead to further researches. Now let's talk about the fourth theoretical approach. First, we have functional theories. It explains psychological phenomena in terms of their function or purpose. For example, one prominent theory of repeated self-injury, such as cutting, is that people do it because it produces a short-term reduction in the intensity of negative emotions that they are feeling. Note that this theory does not focus on how this happens, but on the function of the self-injury for the people who engage in it. Next, we have mechanistic theories. It focuses on specific variables, structures, and processes, and how they interact to produce the phenomena. This example is a simplified representation of one contemporary theory of hypochondriasis. This theory focuses on key variables and the relationships among them. Hypochondriasis is an extreme form of health anxiety in which people misinterpret ordinary bodily symptoms as a sign of serious illness. For example, if you are experiencing a headache, you may think that you already have a brain tumor. This theory explains that people who are high in the personality trait of neuroticism start to pay excessive attention to negative health information, especially if they have had a significant illness experience as a child, or maybe a seriously ill parent. Now, this attention to negative health information then leads to health anxiety and hypochondriasis, especially among those people who are low in effortful control, which is the ability to shift attention away from negative thoughts and feelings. And for the third one, we have stage theories, which specify a series of stages that people pass through as they develop or adapt to their environment. Famous stage theories include Abraham Maslow's hierarchy of needs and Jean Piaget's theory of cognitive development. And lastly, we have topologies. It provides organization by categorizing people or behavior into distinct types. This includes theories that identify several basic emotions, several distinct types of intelligence, such as Gardner's theory of multiple intelligence, and distinct types of personalities, such as Peak 5 personality trait theory. Now, how can we incorporate theories to our research? When you do write your research, be aware that there are two basic ways that researchers usually include theories. The first is to raise a research question, answer that question by conducting a new study, and then offer one or more theories to explain or interpret the results. This format works well for applied research questions and for research questions that existing theories do not directly address. The second way is to describe one or more existing theories, derive a hypothesis from one of those theories, test the hypothesis in a new study, and finally reevaluate the theory. This format works well when there is an existing theory that addresses the research question, especially if the resulting hypothesis conflicts with a hypothesis derived from a different theory. And now we are done with our lessons regarding theories and research. I hope you learned something new, and God bless and stay safe, everyone.